Hello everyone, my name is Christian Solomon and I will be doing my presentation on substance abuse in rural areas. So substance abuse is the use of or mood or behavior altering substance resulting in significant impairment or distress. Substances misused in rural areas are illegal substances, tobacco, alcohol, over-the-counter medication, and prescription medication. Substance abuse can result in addiction and chronic brain conditions that can affect one's mental health. It can also affect the individual's family and or community. Some behavioral signs to look out for would be the lack of motivation, poor work performance, an outbreak of temper, persistent dishonesty, and a general change in their overall attitude. Factors contributing to substance abuse in rural America would be low educational attainment, poverty, unemployment, high-risk behaviors, and isolation. The ones that stood out most to me was, of course, poverty and unemployment. Of course, we've talked about both of these rates in rural and urban, and I can agree that while I was doing this research, poverty and unemployment were the highest rates for individuals suffering from substance abuse and suffering from addiction. So challenges in rural areas would be the lack of self-motivation, lack of technological resources, lack of educational resources for clients, lack of good facilities or even close facilities, and the lack of transportation. The theoretical framework would be assessments, family system theory, and social support. So assessments would be for the individual and the individual's family. Assessments are put in place to understand the root of the issue. So we would use an interviewing style / assessment for the family. Getting the individual to develop the life cycle transitions such as genograms and echo maps, which we have covered in this course and in other courses during our graduate level journey. So social support would be support groups, getting the individual in a group with individuals who are struggling with the same addictions, like-minded individuals. Put them in a goal-oriented focus group. I'm just focusing on coming out of whatever addiction that they have. Family support, getting the individual to attend counseling with the family. Counseling gives the individual and the family a chance to address the issue as a whole, using the strategic structure systems engagement. Substance abuse effects on the community. Substance abuse within rural communities can present problems such as an increase in crime and violence, car accidents caused by individuals driving intoxicated, a widespread of infectious diseases, fatal alcohol syndrome, high-risk behaviors, and homelessness. So community efforts to address substance abuse could be family-centered prevention programs, just giving the community a chance to gain knowledge about substance abuse. So improve knowledge of children and parents, improve communications within families. Churches and faith-based organizations can promote substance abuse prevention, especially schools, discouraging youth from using drugs and alcohol, When I want to say when I was in middle school, an organization called DARE, which stands for Drug Abuse Resistance Education, they put on a big program for all the middle schools in Birmingham City Schools. I want to say I was in the 6th grade, and I just feel like that was a great program. They did a speech, we did a parade. It was just a great day of education around drug abuse. Basically trying to prevent us from using drugs in the future. So this is a chart that I wanted to include in my PowerPoint. I'm not gonna go through the whole thing, but alcohol used by youth age 12 through 20 was the highest, and it's 37.8% in the non-metro, 35.3% in small metro, and 34.3% in large metro. But I'm gonna let you guys look over it before I turn it off. Social work practice in rural areas. Social workers should refer back to the NASW when it comes to working with clients. So the concerns of equality, client strengths, the right to self-determination, social justice, and public welfare. Place emphasis on the value of ecological, person and environment, or systems perspective to social work, education, and practice. Case management in rural areas could be things such as linkage to care, which is one of the most important case management duties. So linkage to care, providing valuable resources to the client, educating and advocating for more beneficial resources, and providing transportation services. But linkage to care is so important to me. I work at Birmingham AIDS Outreach, and we have a Hep C program, and as soon as the people who work on the Hep C program find someone who is reactive to Hep C, they get them linked into care. And I just think it's so amazing how fast they get people either engaged or re-engaged back in care. Of course, people do relapse, but it's really important to get individuals who are willing to get linked into care, get them all the resources that they need. It could really be life-changing for some people. Some policies around substance abuse are 21st Century Cures Act, the Comprehensive Addiction and Recovery Act, Affordable Care Act, Tribal Law and Order Act, Mental Health Parity and Addiction Equity Act, Americans with Disabilities Act, Sober Truth or Preventing Underage Drinking Act, and Substance Abuse and Mental Health Services Administration, which is known as SAMHSA. So Bradford Health Services is one of the treatment facilities here in Birmingham. Some of the services they provide are adult and adolescent detox and rehab, family support programs, young adult rehab, outpatient programs, and outpatient educational programs are some of the programs that Bradford provides. And that is the end of my presentation. I hope you guys enjoyed this video, this presentation, and learned something from this presentation. Thank you guys for tuning in, and I hope you guys have a great day.